If you're on Medicare, or turning 65 soon, what you're about to hear could save you thousands of dollars. Because right now, millions of seniors are making Medicare mistakes that quietly drain their retirement savings every single year. And the worst part? Most people don't even realize it until it's too late. In 2026, Medicare got even more expensive. The standard Part B premium jumped to $202.90 a month, nearly a 10% increase. That means the cost of getting Medicare wrong is now bigger than ever. And today, we're exposing the 5 hidden Medicare mistakes that financial advisors say are costing retirees the most money right now. One of these mistakes creates a permanent penalty that follows you for the rest of your life. And another mistake can leave you stuck with massive hospital bills, even if you thought you were fully covered. So before your next enrollment period, watch this carefully, because mistake number 3 catches almost everyone off guard. And stay until the end, because the final mistake isn't about penalties at all. It's about benefits Medicare already gives you for free that most seniors never use. And ignoring them can become extremely expensive later. Mistake number 1, the birthday trap. Most people think Medicare enrollment is automatic. It's not. And this misunderstanding is costing retirees thousands of dollars. Here's the trap. Around your 65th birthday, Medicare gives you a very specific enrollment window. Miss it, and you could face a permanent financial penalty for the rest of your life. Not a one-time fee, a monthly punishment added forever. You get a 7-month enrollment period. 3 months before your birthday month itself, and 3 months after. Miss that window without qualified coverage, and Medicare increases your Part B premium permanently. In 2026, the standard premium is $202.90 times 0.10 equals 20.29. That means every year you delay adds another $20.29 every month, forever. Delay by 2 years? Now you're paying over $40 extra every month for life. Over a 20-year retirement? That can cost nearly $10,000 for a paperwork mistake. And here's where people get blindsided. Many retirees assume they're covered under a spouse's work insurance. Sometimes they are, sometimes they are not. And if Medicare decides that coverage wasn't creditable, the penalties still hit, even if you honestly thought you were protected. Comment below, did Medicare automatically enroll you? Mistake number 2, the $0 plan illusion. Now let's talk about the mistake that looks smart at first, but becomes extremely expensive later. Medicare Advantage plans. Millions of seniors choose them because the ads sound amazing. $0 premiums, dental, vision, gym memberships. But what many people discover too late is that cheap monthly premiums do not mean cheap healthcare. Here's the problem. Many Advantage plans restrict which doctors you can see. Some require referrals. Others require prior authorization before treatment. And some retirees discover their preferred specialist isn't even covered, right when they actually get sick. One retiree switched to a Medicare Advantage plan to save money while healthy, then later developed a serious heart condition. Suddenly, their specialist was out of network. Treatments needed approvals, and switching back became difficult because of underwriting rules. That's the part many seniors never hear about. In many states, once your guaranteed enrollment window closes, insurance companies can deny Medigap coverage based on your health, meaning you can get trapped in a plan you no longer want. And wait until you hear the next mistake, because this one creates a lifetime penalty, even if you never took a single prescription drug.
Mistake number 3, the healthy person penalty.
This is the Medicare mistake that surprises almost everyone. People skip Part D drug coverage because they feel healthy, and logically, that sounds reasonable. Why pay for prescriptions you don't need? But Medicare doesn't care whether you needed medication or not. If you delay Part D without qualified drug coverage, you get penalized permanently for life. The penalty works like this: 38.99 times 0.24 equals 9.36. A 24-month delay adds about $9.36 every month, permanently. That may not sound huge, but over retirement, thousands of wasted dollars for doing nothing. And the cruel part? Most people don't realize the mistake until after they finally need expensive medications. By then, the penalty is already locked in. Forever. Mistake number 4. The drug cost strategy nobody explains. Now here's something Medicare almost never explains clearly. Part D coverage works in stages, and understanding those stages can save certain retirees a surprising amount of money. In 2026, your out-of-pocket drug costs are capped at $2,100. After that threshold, covered medications cost you nothing for the rest of the year. And this creates a strange strategy opportunity. Some retirees on expensive medications actually benefit from reaching that cap earlier in the year. How? By using 90-day prescription refills in January instead of monthly refills. That pushes them into catastrophic coverage faster, meaning more months paying zero afterward. And here's another expensive mistake. People keep the same drug plan year after year without checking changes. But formularies change constantly. A medication that was cheap last year can suddenly become expensive next year. That's why Medicare open enrollment matters so much. Even one plan change can save hundreds, sometimes thousands. Mistake number 5. The free benefits almost nobody uses. Now for the most ignored Medicare mistake of all. And surprisingly, this one has nothing to do with penalties. It's about benefits you already paid for, but probably never use. Most seniors don't realize Medicare covers a huge list of preventive services completely free. No copay, no deductible, no out-of-pocket cost, including annual wellness visits, cancer screenings, diabetes screenings, vaccines, bone density tests, depression screenings, and yet millions never schedule them. The annual wellness visit may be the most valuable benefit seniors ignore, because catching problems early is almost always cheaper and safer than discovering them later during an emergency. This week, call your doctor and say, "I'd like to schedule my Medicare annual wellness visit." That exact wording matters, because it helps ensure the visit is billed correctly under Medicare. Let's quickly recap the 5 Medicare mistakes costing seniors the most money in 2026. Missing your enrollment window. Choosing plans based only on low premiums. Skipping Part D because you feel healthy. Ignoring how drug coverage stages work. Never using free preventive benefits. The truth is, Medicare can either protect your retirement or quietly drain it. And the difference often comes down to knowing rules most people were never properly taught. If this video helped you, share it with someone approaching retirement. you could genuinely save them thousands of dollars. And if you want more simple retirement and Medicare breakdowns designed specifically for adults over 55, subscribe to Silver Wealth Tips right now. Because in the next video, we're exposing the retirement withdrawal mistake that financial experts say can silently cost retirees over $150,000 in unnecessary taxes. And most people don't discover it until it's already too late. Thanks for watching, and take care of both your health and your wallet.